Access to healthcare is seen as one of the most important determinants of health. It can be broken down into a few different aspects. These include your proximity to health services and whether you have to drive to another community to see a doctor or a pharmacist. This also includes affordability. Can you afford your prescriptions? Do you have benefits? The service you need might not be available. Not every community will have a cardiologist, neurologist, or even a family doctor. But there is another facet of access to healthcare that is often overlooked, and that one is in the realm of cultural safety. You see, cultural safety is somewhat difficult to measure. It is not as easy as saying you live 400 kilometers away from a neurologist. People's level of connection to their culture can be different as well. There can be differences between communities, geography, historical traumas, and families.
I'm connected to my land and my people, so I consider that cultural because I have a lot of respect and love for my culture.
I would consider myself a cultural person. I wouldn't say that I'm well versed on culture, but I would consider myself a cultural person. I'm a very spiritual person, and culture is very spiritual. I'm trying to learn my traditional ways, but I'm also trying to respect the traditional ways of the territory that I'm in. So I'm also trying to learn some of the traditional ways of the Blackfoot people because that's the land that I reside on.
I have a lot of memories of, going down to Siksika, spending summers there, being with my grandparents. I have a lot of memories of my grandpa telling stories in Blackfoot and just sitting outside for hours.
And if people's level of culture is different, then they must have different needs when they enter the health system.
Cultural safety means to me, it means ceremony, it means sundance, it means talking with the elder, just being with a bunch of different Nitsitibis, It's easier to talk to people when you have a connection to the land. You're able to make that connection with each other.
Cultural safety is important to me because as First Nations people, our culture is our foundation. And if our culture is not respected or kept safe and sacred, then we as individuals, but as a race, are being discriminated against. It violates our safety. As a patient, cultural safety to me means that my values, my beliefs, and my ways are going to be respected. I'm not going to be ridiculed or mistreated or receive lesser care based upon my culture.
When I think of cultural safety, to me it's learning the correct way to start an interaction with a person of culture. I don't think that's strictly to do with Indigenous people, but any culture, any background really. Just, learning steps and putting those steps into motion to start your interaction with that person in a way where you don't accidentally do something inappropriate or racist or something like that, by accident.
A quick Google search shows cultural safety as the effective nursing practice of nursing a person or family from another culture. But the one question you may have is, well, what does this look like in person?
So for me, I think the ideal healthcare experience would be, walking into a space and feeling really seen, feeling accepted and that sense of belonging. I do think that it is really important for there to be representation. So nurses and doctors and healthcare professionals that, look like me, look like my aunts, look like my family. I think that is, something that represents safety in terms of, that whole systemic approach.
I have to say where I go, my personal family doctor, where I go to the clinic, that to me is the ideal experience. You go in, you're greeted in a friendly way. So, oh, hi, how are you? Welcome, come and sit down, doctor will be with you. Come in, I'll say, oh, do you want some water? We're gonna be a bit of a wait, here's some water, and they'll just sit there and chat with you. How's the family? How's your folks doing? When my late grandfather was still alive, he experienced the same treatment. My family doctor is not my grandmother's family doctor, but he looks, he sends me a message, how's Eileen doing? How's her health doing? Make sure she's going for her diabetes test and so on. And that is proper care.
I would like to see where the healthcare staff, like the ultimate interaction to me would be a healthcare staff who interacts with everybody on the same level, with the highest level of care that they can provide, because that's their job. Your job is to take care of that person no matter who they are. I would like to see that, as well as people actually interacting with people and asking questions. Is there something I can do to help you further? Do you need somebody? You know, like, do you need a priest? Do you need an elder? What can I do for you to make this experience better, and give them the highest level of care that's within your ability? And, you know, ask questions, because people will tell you, you know, but the biggest thing that I can say is don't assume. Do not make assumptions, because that's how we all get into trouble.
What we have heard is to begin by doing your own research, but not being afraid to ask questions. As doctors, nurses, pharmacists, and therapists, you first learn the theory of practice by studying in a classroom, and then working under supervision of a practicing professional. This doesn't end once you graduate. If you want to be culturally safe, first you must educate yourself about residential schools and the history of colonization, then go to community and ask questions. You can learn from your patients and clients as much as they learn from you.
If you're there for the people, you'll know how to get through to the people.
Environments that are really stressful, especially within the healthcare system, but to be able to kind of ground yourself in whatever way, I think that's only going to help, you know, to meet people in a good space and to do that work in a good way.
You have to be compassionate to help the people. That's what helping field is all about. That's where we begin.